I'm the Nurse Navigator for the Breast Health Center for Wellstar MCG Health.
Thank you so much for joining us today. For October is Breast Cancer Awareness Month, and even though we're at the end of the month, we're going to round out some awareness for anybody at home talking about this issue. Now, we were just speaking about it, and you said there has been a change in at-home awareness. Can you talk a little bit about that?
Sure. So in years past, national guidelines recommended monthly breast self-exams. And while that is not a bad habit to maintain, that is not necessarily what the guidelines are pushing so much anymore. They are more so pushing just a level of breast awareness. That is the verbiage that is used in the national screening guidelines. Being aware of how your breasts look and feel normally, that enough so that you could recognize a change, speak to your doctor about it, and get it worked up further.
Right. Now, when we talk about breast awareness, of course, with something like breast cancer, it's not just women, it's men too. So how does that maybe look different or look similar when we talk about breast awareness?
So it definitely could look similar for men. When we talk about breast awareness and things to look for in terms of changes, we're talking about new lumps, new bumps, nipple discharge, skin changes, things of that nature, and those can present in men as well.
Right. And so if somebody is noticing maybe some changes, or maybe they're not noticing changes but just want to be sure that they're keeping up with their health, we were talking about the importance of mammograms. Can you touch on how just effective mammograms can be in this
Absolutely.
process?
So screening mammograms are still the gold standard in early breast cancer detection. While we do know that breast cancer, the incidence of breast cancer is on the rise, the mortality rate from breast cancer is on the decline. And the reason is because we're finding these cancers earlier using screenings. National guidelines recommend that women of average risk, they begin annual screening mammograms at age 40. We encourage all women prior to the age of 30, as a matter of fact, to actually talk to a healthcare professional about doing a risk assessment. It's simply a questionnaire that analyzes their personal history as well as their family history to determine, are you at average risk for developing a breast cancer, or are you at higher than average risk based on certain factors? If you're at higher than average risk for a breast cancer, your screening journey may begin earlier than age 40. We don't have a great way to prevent breast cancer outside of drastic surgeries that are not appropriate for everyone. So our best tool is early detection.
Right. And when we're talking about the risk level of certain clients or patients rather, if somebody maybe doesn't know their medical history, their family's history, or things that could impact that, how does this assessment help them figure out how much they are at risk?
So having a certain amount of knowledge about your family history is important. However, the personal history is a huge factor in that risk assessment as well. We do know that only about 15% of breast cancers have any ties to hereditary factors. 85% are random.
Really?
Yes.
So is that a common misconception?
Yes.
Okay.
Yes, people say, oh, it's not in my family.
Right. That's what I'm sitting here thinking.
Yep. You could still be at risk for developing breast. I mean, any woman, if you have breast, you have a risk of developing breast cancer over your lifetime.
Right. And so can you just talk a little bit about, at home, what people need to do if they think it's not me, this would never happen to me, or I'm immune, or whatever reason, maybe I don't have family history with it. What are the emphasis on the stress points that you're going to put out? Like what are we telling them?
I would just tell them to just try to get out of your own head in that this risk doesn't apply to me because I don't have a family history. I will share that I don't have a family history of breast cancer. I'm 40 years old. I was diagnosed with breast cancer in April, and it was found on a screening mammogram. I was having no problems whatsoever, had no symptoms. It was just time for me to have my mammogram, and there it was.
Wow.
And fortunately, it was found early, stage 1. I was able to have surgery. All margins were clear. Lymph nodes were negative. I did not require chemotherapy, did not require radiation because of the type of surgery that I chose. And I'm fortunate I take tamoxifen now, and I'll be on it for 5 years. But had this not been caught, my journey would be very different.
Wow, and thank you so much for sharing that, and congratulations.
Thank
but
you.
I mean, it really is a testament to, like you're saying, early detection can save lives.
Absolutely.
You're in this field. You
Yes.
work in this field, and the thing that maybe saved your life is this early detection and being aware and knowledgeable.
Absolutely.
Awesome. Well, right before we, get out of here, can you tell some people at home just very last points, what they need to do, when should they be scheduling those mammograms, the importance?
Ladies, please make sure if you're 40 years of age or older, screening mammogram, you can self-refer. You don't even need a physician's order for a screening. Now, if you're having an issue, any kind of new lump, new bump, that's different. You'll need a diagnostic mammogram. Screening is not appropriate for you. Ladies under the age of 40, please speak to your physician about a risk assessment. Find out what your risk is. If you're at average risk, wonderful. Start your mammograms at 40. If you're higher than average risk, talk to your doctor about what the recommendations are for screening for you as an individual.
All right. Well, Nurse Erin, thank you so much for joining us and sharing your story with us.
Thank you.
You're a testament to everything we're trying to bring awareness to right now.
Thank you very much
for joining us.